Good morning. I'm Chris Clark, President, CEO of the Georgia Chamber of Commerce, and I want to welcome you to our weekly COVID-19 town hall. Today, we're happy to be joined, as always, by Santiago Marquez, who's President, CEO of the Georgia Hispanic Chamber of Commerce. Santiago, thank you for your partnership through all of these town halls. It's been great to do these with you. I also want to thank our friends down at Levy Studios for helping Georgia businesses reopen safely. And as always, our friends at Georgia Public Broadcast and Georgia News Network for sharing the information that we bring to you with Georgia leaders about where we are in the COVID-19 recovery and how we continue to move our state forward. I do want to remind you that we have the most recent overview of Governor Kemp's orders, as well as federal information at gachamber.com/COVID-19. I also want to remind you to join us for our roundtables, which next week we'll have Commissioner Pat Wilson from the Department of Economic Development, along with other economic developers, to talk about the recovery in Georgia. We'll be having that on Wednesday. You can also follow us for our other town halls on our social media. So today we're excited to have with us Dr. Kathleen Toomey. She's the Commissioner of the Georgia Department of Public Health. Probably everybody in the state of Georgia besides the governor. Dr. Toomey, you probably need no introduction, but we're excited to have you. For those of our listeners that don't know Dr. Toomey, she's an epidemiologist, which before this, none of us knew what that is, and now all of us know what it is and know how to spell it. She's also a family practitioner, formerly worked at the CDC, has been involved with numerous healthcare crisis and management around the country, around the world, quite frankly. And I think it's just been fate, and just we're so fortunate as a state to have you in this role during this critical moment and all of your background leading up to here. And so the business community is listening in today from around the state of Georgia. We're excited to hear where we are, and more importantly, the role that the business community can play to help you do your job to help keep Georgians safe. So again, Dr. Toomey, thank you for your leadership and everything that you've done, and we look forward to hearing where we are.
Ready to go?
Yep, I am pulling up your PowerPoint.
Yeah, thank you very much. It's a privilege for me to be with you this morning. It's a tremendous opportunity for me to talk to you about what we're doing to address COVID-19 throughout Georgia, but most importantly, to think about how we can work together. It's going to require the entire community to work together in coordination and collaboration. And you, as Georgia's business leaders, can play a very important role in helping us get information out to the community as a whole and to your employees about what we are doing and how we can work together to address COVID-19. Let me just talk a little bit about the Healthy Georgia Collaborative, which is our contact tracing program. And we really liked that name because it emphasized that the purpose of this is to keep Georgia healthy. And that, again, is going to require a community effort with the engagement of the business community. What is contact tracing? What are we doing? How does this stop the spread of COVID-19? Contact tracing is something that we have done for many years for many conditions, but it's particularly important for COVID-19 because of how easily this is spread from person to person. And so that testing followed very, very quickly by contact tracing is something that we must be doing to ensure that COVID doesn't continue to spread through our communities. The success of this fight will be dependent on all of us working together and ensuring that everyone understands that testing followed by isolation of individuals who are infected, and then followed by contact tracing, which is going to inform everyone who may have been in close contact with those cases that they may be at risk, and to ensure that they are able to quarantine and stay away from potentially infecting others. And we will offer everyone who's a contact, we will offer them all testing. This is something that we will be working on with all of our health directors throughout the state, and we hope we can engage you as the business community to be part of this effort. We are looking at a coordinated response across all of our agencies with the medical community and with the private sector. Clearly, this is something that where your leadership will be critical for us throughout the state. We have actually worked very, very aggressively to develop a plan and guidelines and have been able to bring on board hundreds of workers, including student workers who are on leave from their universities right now and med schools. And by mid-month, next month, so by mid-June, we will have 1,000 contact tracers deployed across the entire state. We need that many people to be able to very quickly be able to identify individuals who have been exposed and ensure that they get that prevention information about staying at home, staying in quarantine, and allow us to stop the spread of COVID. Again, this is where I think your engagement, your cooperation, and your assistance in getting this message out will be so helpful. We streamlined our tracing and monitoring efforts with reporting, which will be available eventually online so that everyone can see what we are doing and how we are doing it. But probably the fourth focus area, communications and community outreach, is, from my perspective, the most important one. I worked for many years on contact tracing issues and evaluating and assessing contact tracing for a number of health conditions. And to me, the most important criteria for this to be successful is that the community themselves are engaged. And that's going to require communication and public trust. And so I look forward to getting your feedback back on how we can engage businesses throughout the state to help us. You can see these are just some of the numbers that you may be interested in, just that we have so many people already working with us throughout the state. 14,000 individuals have been identified as exposed to the COVID-19, and that we're so far identifying almost 3 people per case as being close contacts. If we get them early, if we get them into quarantine, if we get them tested, we may identify asymptomatic cases, but also potentially stop future cases from spreading if we can keep them at home during that quarantine period. This is a critically time-sensitive activity. That's why so many people are needed, but also that's why engagement with community leadership like yourselves is so important. I think this this contact tracing process is something that is probably more information than you ever wanted to know about it. But close contacts are going to be monitored for 14 days and tested. I think that's an important point to make, is that this whole process is triggered when someone is identified as being a case, and then that puts in motion all this contact tracing activity that will ultimately include a test. And we will have the capacity to do every case and every contact as we continue throughout the state. And I'll take more time to explain that if necessary. We have a web-based tool which is allowing us to streamline some of these efforts. I wanted to explain that this is not kind of a Bluetooth type of application, that this isn't going to monitor everybody's movement. There was a lot of concerns, kind of civil liberties concerns about that, and we are not doing that. And I, frankly, having worked on this for so many years, feel that human engagement is actually more effective than tracking by your cell phone. But our application that we've customized with Google allows individuals in isolation and quarantine to self-report. And this will kind of streamline the work and eliminates the need for us to be contacting everybody daily by phone. and this will help us to do our work faster and more efficiently. Clearly, our goal is to help you keep your employees as healthy as possible, as well as use the opportunity of your leadership within your communities to help us get the word out about this, not just through your own employees, but also to throughout the community as a whole. You know, you are recognized as leaders, and that your employees matter, as does your leadership in the community. And so we're looking at how we can keep businesses healthy and help you as you reopen. We want to promote a safe workplace. If where possible, to structure spaces and teams to minimize risk. And we're doing that at Georgia Public Health. We're social distancing. I'm not wearing a mask now because I'm almost alone in this room, but you know, we are wearing masks when we're in close proximity, and to continue to communicate with us and to engage with us, how we can support you throughout the state. The business community can support our efforts through a lot of ways. As I was saying, I think the biggest challenge we've had is that people don't trust somebody calling them on the phone, that it's not spam or somebody trying to get confidential information. And I've gotten a million of these calls. And so I think one of our goals is for you to help us get your employees and others in your community to understand what we're doing and how we're doing it, and then a call from the health department is a good thing, not a bad thing in this case. It's helping us keep Georgia healthy. So you can help us raise awareness, you can help us educate employees about the importance of contact tracing, how it works. But I also, because of your leadership within your communities throughout the state, you can also help raise participation throughout your communities, not just within your immediate employee circle, and help support your employees as well as the broader community to adopt new behaviors, to continue to social distance, to continue to recognize that we believe this COVID-19 will be with us for a while, and until we get a vaccine that actually will prevent it, it's going to take all of us working together to stop the spread in our communities. So key messages to remember, to share with your employees. We have this handout that we can share with you to get to your employees. First of all, we're all in this together. It's so critical we all work together to ensure that we stop the spread of coronavirus throughout Georgia. We are the Georgia Public Health, both here at the state office as well as locally, is your source of information as well as your source for testing and contact tracing. If you believe you've been exposed, if you have employees who've been exposed, encourage them to get tested. We can help you do that. Ensure individuals are isolated if exposed and can quarantine if they're contacts. Remember that all testing and contact tracing is absolutely confidential. I'm sure that many of your employees have concerns, and particularly because there's been some recent media publicity about a cluster of cases here in Atlanta. That information about those, that testing and investigation was promulgated by, sadly, the students themselves on social media, not by us. And I think that situation has actually done more to kind of hurt our ability to get the information out to everyone about how confidential and important this is. So we will never ask for any personal financial information, social security numbers, any of that. This is important that we just work together to get this information out about prevention. And please, we can get this graphic in a PDF format that you can get out to all your employees and others in the community. I'd like to open it up for questions. I probably talked longer than I was supposed to, which is my usual My usual MO, because I get very excited about this work because it's so important. Prevention is key for our being successful in stopping the spread of the virus. And your partnership with us in prevention is an essential component of that. So I thank you for your attention and opportunity to address you today.
Dr. Toomey, thank you. You don't talk too much. We take it all in every time you're in front of the camera, so we appreciate that. You know, one of the things that we've been telling Georgia businesses now for the last 6 weeks is no matter what your company does, you're now in the health and wellness business too. You have to have the plans to do this, to be part of the effort. If you want to stay open, if you want Georgia's economy to recover, you've got a role to play to protect your employees, customers, clients as well. So we do want to take the information you've got and send it out to the chamber networks and every business in our state. And you've got our commitment to do that. So we've got a few questions from our members around. And Santiago, I'll let you ask the first question, then I'll follow up after that.
Thank you. Thank you, Dr. Toomey. We appreciate everything you're doing for us and your leadership. As the state continues to reopen the economy, how does the DPH plan to address any potential coronavirus hotspots over the coming months?
That's really an important question because I think the hotspots are to us the indicators where there are problems, and we are monitoring them several times a week. We actually generate a hotspot map. You know, somebody asked me yesterday, how do you know when we're moving too fast, or how do you know when we're opening things too quickly? And to me, what's more important than just the daily trend of cases, but it's actually this hotspot analyses that we are doing on a regular basis. When there is a hotspot, we will quickly intervene. We will work with the local community, including the business community, to ensure that we take aggressive action for widespread testing, appropriate isolation and quarantine, as well as education in the community. I had the privilege of being in Gainesville a couple of weeks ago where I met with community leadership, and it was just, to me, a tremendous opportunity to see where the community itself was playing such a leadership role in getting education out to businesses, to the widespread community. It's that kind of local engagement when we identify hotspots that will ensure our success. This is more than just a public health effort. It's going to take all of us working together. But the hotspot analysis is, to me, one of the most critical pieces of our work.
Yeah, thank you, Doctor. And I know that some of the folks up in Gainesville think really highly of the work you did up there. Thank you for going up there.
No, my pleasure, my privilege, actually.
So, Dr. Toomey, I know that the governor mentioned yesterday that he was, weighing lifting other restrictions and looking at some of the other businesses that are still closed. We've had so many businesses have been able to continue to operate under this minimum basic operations, and that's really been a savior and I believe a great national model. You mentioned specifically a moment ago continued social distancing. You mentioned face masks. Just we're preaching the same thing, but I'm curious. As we all learn to live with COVID-19, changing habits, practices, business operations, what are the most important things that you want to tell Georgia businesses so that you can mitigate the virus spread and keeping the economy open? What is the best advice? What's going to be the going forward recommendation here?
I think what I would recommend is continue, if at all possible, the social distance, but also wearing masks if you're in close proximity, frequent hand washing, frequent cleaning, not just of surfaces, but of restrooms and other areas that are high touch areas. I think businesses can safely reopen. We just have to ensure that we recognize that the virus is still here with us and continue to take personal precautions, both as businesses, but also as our employees, to be mindful of what they can do. And I've seen this here, even within our own building. We've continued to work, that people are careful to be socially distanced and not sitting next to each other in the break room, washing hands frequently. These are all things that I think we need to continue until we are further along in this outbreak. But I think it's important that business continues to open. I think this is a very important thing for us as a state, but also our population needs to work, and we know that. And so what my job is, along with my staff, is to ensure we can protect the economy at the same time we protect people's health. And I think we can do both.
Right. Thank you. Santiago?
Yeah, Dr. Toomey, how can the business community be a partner in the effort of contact tracing? I know we had one of our members that told me the other day that he had an employee that fell ill and they had to go through the contact tracing process, and it was cumbersome. But so how can the business community be more proactive and be a partner in that?
Oh, I'm happy to answer that question, because I think just raising awareness that this is going on and encouraging your employees to respond and be cooperative is absolutely an important role you can play that is unique in the community, because you have that daily contact with your employees. You can say this may be happening, and if you do, have a case of COVID in your work site, which is inevitably going to happen, ensure that those precautions are taken, that education goes out to the entire workforce, and that you follow the guidance working with local public health to ensure that employees are safe. I've gotten personal phone calls from everything from hairdressers to gyms, and other small businesses about how can we open, what do you recommend, what are your thoughts about this? But thank you for allowing us to open. And I think, to me, that was so gratifying, is that the precautions, are important, but also that they are continuing to safely reopen to the benefit of not only their clients or patrons, but also of their staff. And I think to continue to get that education out, alert us if we can come and help you, again, in a confidential way, particularly if there is a case, and let us help you to facilitate testing if that's something that you want to do as a business. Some businesses have reached out and want to do widespread testing. We can help to help you design that testing strategy and even work with you to do that. So there's a lot of ways that I see your leadership in the business community within your own companies, within your own factories, within your own small businesses can help us to sort of be part of our team to make this successful.
Dr. Toomey, early in this process, the governor's office was encouraging us to make sure that our local chambers were partners with their local health departments so that they could respond very, very quickly. We continue to promote that. Hopefully you're seeing that, but if not, please know that there's anything else we can do to make those connections at the state, at the local level, so that those businesses, feel more comfortable calling maybe the local folks. Just let us know how to do that, but just know we're cognizant of that, the importance of that issue.
This is such a timely discussion, because I'm actually meeting with the health directors tomorrow, and that's the first priority on the agenda, is to talk about how some of the districts are very proactively working, and for those who aren't, how can we encourage the districts to be more proactive to reaching out with the business community? What are some successful models? And as you probably are aware, I had reached out to the Atlanta Metro Chamber, that's actually a misnomer. They reached out to me, and I jumped at the opportunity to address them. And I think we should work together, both chambers, to think about how together we can maximize our work together throughout the state.
Right. Well, we have 161 local and binational chambers that are part of our chamber federation. And so we've been helping them literally all over the state set up recovery task forces for the last literally 3 months now. And so many of them have already made those connections, but please encourage those health department directors that local chamber is their clearinghouse and they're ready to go, and we'll provide them support. Speaking of them, as we've been on here, I've gotten dozens and dozens of texts from folks saying, please ask Dr. Toomey this question. So forgive me if it's a little bit of a curveball, but it's top of mind for a lot of our listeners today. A lot of our local chambers host large events. They host annual meetings. They host festivals and parades in their communities. And many of those obviously have been canceled and postponed. We were talking yesterday to the folks in the tourism industry that have had to postpone, large events. Maybe it's 500 people in an event. Maybe it's, 3,000 or 4,000. And they're trying to determine now, the text I'm reading says, when can I have my festival? When can I have my annual meeting? When can I have my parade? Any idea from a timing standpoint? Should we be talking to people about looking at August or September, or should we be thinking of different models? What advice do you have for all of our partners out there?
My advice is, let's continue to do what we're doing, and let's continue to follow the guidelines and social distancing. You'll see when the executive orders come out, they're very clear. We're opening up a lot of new opportunities, particularly for children to enjoy the summer, but with protections in place. And I think it will all depend on if we can continue to do this and do it safely and continue to follow those safeguards. I hope by August or September, we will be able to have larger gatherings. And you'll see the executive order. And I never want to say, because I've seen it, but it may change between now and the time it's unveiled, but it's opened up the number of people that can be safely together. I suspect that will continue to open up, particularly as our numbers continue to show a decline, as we continue to work aggressively to identify hotspots and stop spread. I am hoping August and September will be a good time, particularly as we hope that school can reconvene for children. And that's an important other indicator of health of the community. So everything is dependent on how we do at maintaining and curbing the spread of coronavirus, COVID-19. And that's, again, why it's so important that this work we're doing together and talking about today continues to proceed, and really that we work together to make that happen. I think all of us want to have the state open as much as possible and to be able to enjoy these events, but it's going to take all of us working together to keep those numbers looking positive. Not positive, looking good.
Right, yeah, right, and you're in the right direction. I'll let Santiago ask our last question, then I'll come back and wrap us up.
And yeah, and that's, first of all, Dr. Toomey, I just want to say thank you for all your leadership, and especially the work that you did in Gainesville. It meant a lot to our community. So thank you from the bottom of my heart for that. And, I tune in every time you're speaking because I know it's important stuff. What can we do as a chamber, as a Hispanic Chamber of Commerce, to make sure that our community is getting the latest information? How can we better partner with you, I guess, is my last question, because we're here to help as much as we can.
I think that many of our messagings don't necessarily reach the community effectively. And so I think that your help would be much appreciated, not only in letting us know how we can recraft what we're doing to better serve the Hispanic community, but also take some of our work and use the information to reach the community yourselves. In many ways, you are more credible in the community than I am, because you're from the community and you represent businesses there. And I said that to Norma Hernandez because she was leading the efforts. I said, Norma, you can be much more effective than me in your leadership efforts because you are a trusted member of the community and a leader. Let me know how I can help you. And I think it's kind of both those things. Let us know how we can help you move forward, and also how can we craft things that are more effective than perhaps we're doing. We may not be reaching the right individuals in a way that's adequate. Maybe videos would be more effective. And certainly having other spokespeople like yourselves, like Norma, to be part of this effort rather than trying to do it ourselves. And any ideas you have for me, I think my email's online. Please email me. I really look forward. I actually read every email, and I really look forward to getting that feedback.
Thank you, Doctor.
Great. Thank you, Dr. Toomey. And again, thank you for your leadership in the state and this information, and know that the Georgia Chamber and all of our partners around the state are here, willing, ready to help, and will continue to do our part just as you continue to lead our state. So thank you for what you've done and will continue to do for all of us. I want to again remind everyone that's listening that we do have our Resiliency Roundtable on June 3rd at 1 o'clock with Commissioner Pat Wilson and other economic developers. And on June 4th at 2 o'clock, we have our next town hall, and it's with Morning Consult Chief Research Officer Kyle Drop and economist John Lear, who will talk about consumer confidence and what you can do as a business to raise consumer confidence as people come back into your places of work, which we know are vitally important. So continue to follow us at gachamber.com and on Twitter and other social media, and may God continue to bless our great state. Thank you and stay safe.